Thanks for staying with us. It's been a month now since the vaccination drive began in our country on 16th of January is when phase 1 began, which is to do with the vaccination of our healthcare workers and the frontline workers. Roughly 3 crore of them were slotted for vaccination in the first phase. Now, where do we stand a month into this entire process? India, viewers, has now vaccinated 87.4 lakh people. Now, this is just the first dose and some of them with the second dose. But this is not to say that we've finished both doses for 87.4 lakh people. Of these, the healthcare workers are about 62.82 lakh, within which 61 lakh have got just one dose and about 1.7 lakh have actually also got the follow-up dose, which is supposed to be after 28 days. And so effectively, that round has just started 2-3 days ago. Then there are also about 24.57 lakh frontline workers who've been vaccinated. Your policemen, your army men, all of those. But a target was 3 crores. Not a target for 1 month, but that's the first lot. In a population of 136 odd crores as of the 2019 census. At this rate, we're going to take a long time. Now, I'm not saying it will be at this rate. Obviously, with each passing day, we're hoping that the process becomes faster and faster. But here is why I believe that the government really needs to step up, move to the next gear, step on the pedal, and really quicken up this process. Why do I say that? Because if you look all around the world, many countries are looking at the next big wave, second wave, third wave, call it what you want, the next big wave of cases on the rise. And we need to ensure that we don't go there. That what we managed to do in the last few months remains so, and we don't get into the next big round. How do you do that? You fasten your vaccination process and get more and more people immunized. Then look at what you're staring at in states like Kerala and Maharashtra and some other parts where numbers have slowly begun to go up. This rise has already become an alarm in Maharashtra and Kerala, which is why we cannot wait for things to get out of control. We are in a race against time. When we have the vaccines, we need to get it out there. People are obviously letting their guard down. There is no denying of this fact. You know it and I know it. And it's just about travel or weddings or parties. We're all there. Going to our offices, traveling via public transport, we're in restaurants, we're in movie theaters, and we're not always wearing our masks. Experts also believe, and I agree, that hesitancy that we are seeing now amidst the healthcare workers may just end up creating a bigger concern amongst the other categories of people. And that can cause a ripple effect, which is not good. We need to address these issues as soon as possible. Launch campaigns, spread awareness, open it up to the next lot. Now, the doses are available. Vials are going because not enough people are turning up to get vaccinated. So, the doses that are opened or brought in and can only be stored for a few days in that environment are actually going waste. And you open a vial and you don't use all of it, it goes waste. And that's happening because you're targeting and expecting more number of people to come, but that's not happening. So here is my simple question, and I want you to participate in it as well. So we opened up our phone lines. Pick up the phone, call us and tell us if you think the next phase of vaccination should be fast forwarded. If you believe that if you had an option today, you would take that vaccine, whether it was in the open market, or if you think that the government should at least bring in the next set, those above the age of 50, those with comorbidities. We don't even know what is the exact plan, what is the criteria for those set of people to get their vaccines. That's the simple question. Let's say good evening to the panelists who are joining us right now. Dr. Virender Singh Chauhan, Emeritus Professor for the International Center for Genetic Engineering and Biotechnology, joins us this evening. Dr. Rajesh Parekh, Medical Director of Research at Jaslok Hospital, joins us this evening. Dr. Shashank Joshi, Dean, Indian College of Physicians at Lilavati Hospital, member of the COVID Task Force in Maharashtra. And I also have Tuvin Sinha of the BJP who's with us this evening. Dr. Chauhan, let me start off with you. What's your own sense? There are two camps, ones that say that we're doing a good job, we're moving fast enough, we're much better than a lot of other countries, and there is no need to rush. There are others who say we have the doses, there is a lot of hesitancy, so why not open it up to the other groups as well?
Tanvi, your opening remarks were absolutely spot on. Actually, you covered the whole scenario pretty well yourself. I think there is no case to say that we are doing okay and we should be we should not be hurrying up. I think we are doing pretty well. I would say that, and you, as you said, you can compare with other countries. I think it's a pretty good job, but the pretty good job has to be much better job simply given the population size that we have. And today I was listening to the ICMR director who said that currently today, for example, and yesterday, we are immunized in at least 10,000 places. And there's a capacity to make it to 30,000. So yes, it can be scaled up. It should be scaled up. I disagree with the notion that this pace is okay. But having said that, this pace is extremely good pace, has to hasten up. Now, if we go at this pace, let me just address the other point that you mentioned. It's just absolutely social responsibility. We must begin to feel, oh, but we have huge responsibility. We already have seen the virus. I think that notion has to be cleared very quickly. We seem to be in a slightly comfortable position, and we should take advantage of this comfortable position that there is not huge transmission rate right now. In fact, this is the time when we should enhance, and all of us, I mean, my request would be to the audience and to the public. If you have any queries, questions, please ask. But there is absolutely no other way right now. And remember, vaccine is only one armor that you can throw at the virus. It's not all the armor. So therefore, mask has to be on, tracing has to be done. Today we heard that the mutants from so-called Brazilian mutant or South African mutant, presence is already in India. So without fearing that they are already here, I think we should really buck up, all of us, and especially if the vaccines are there and vaccines are available, they are to be vaccinated. I think all of us should queue up and get vaccinated.
Oh yes, absolutely. Thank you so much for really summarizing those comments there, and I think that we should, if we have the option. But let's see what others also have to say about it. Dr. Shashank Joshi, your view? Can we look at maybe opening it up at least to the next group already, fast forwarding it and saying why not allow those above 50 to start?
Tanvi, you are absolutely right. I think the first phase was very cautious. We have overcome vaccine hesitancy. We have learned a lot from the first phase because these were healthcare workers. They were extremely vigilant about adverse events. We have seen that there is no challenge with either of the vaccines. And I think people have gracefully accepted it. Also, we had a lot of challenges related to the COVID app. I think the teething problems and the learning curve is over now. And now is the time to take off on a fast track mode. So I think the first is complete the vaccination process for the frontline workers and then move to stage 2, which is the vulnerable population above 50 and below 50 with comorbidities. And that 27 crores, they're expecting it to finish by June or July. I think government is doing a commendable job. They definitely need to fast track. And I'm certain that they are open to the private sector and more vaccine centers are coming up. So Tanvi, to answer your question that why in the first 4 weeks we could only do 1 crore is because the number of vaccination centers were limited. But now you can see an exponential geometric progression rise in number of vaccination centers across the country. Because now that we have gone through the learning curve, by the time people above 50 will get the vaccine, which will be another 2 weeks from now, you will have a very large number of centers which will be actually involved in the vaccination process. And in many places, even private hospitals will be involved. So I think with that happening, I think we will be able to fast track this process. But still, 30 crore population, looking at the current estimates of vaccination, probably will take June or July. Every day counts. So the earlier we are able to vaccinate, the better it is. That's a given. But remember, we are one of the largest and fastest vaccination countries on planet Earth. And I think our initial phase and the takeoff with all its hiccups, has done extraordinarily well. And we hope and pray that we are able to do a little faster track involving the private sector. And just to give you an analogy, when we started with testing, initially we had only limited 30 labs which were testing. And later on, we broke all world records in terms of testing. We have one of the fastest turnaround time on COVID testing across planet Earth. And we probably do the largest number of tests on planet Earth. So remember that we were able to turn it around. Even if you go to US, Europe, you will still take a day and a half to 2 days, or sometimes even 5 days to get a COVID report. In India, the turnaround time is only 24 hours. Initially, of course, the takeoff was slow. Similarly, for the first month, I think it was slow, cautious, and appropriate because people also were looking at the teams, state and central government were very closely observing the vaccinees. And I think now the time has come to take off. And I'm certain that the February month and March month are going to be extraordinarily busy months for vaccination program across India. Because remember, this is the largest vaccination drive on planet Earth.
Yes, but some of the insights that we've seen and the government shared today are also very interesting. For example, Tamil Nadu is actually a state which is in terms of the worst performing. If you see as a percentage, they've not even managed to vaccinate 40% of their healthcare workers that was intended. But as a state, they're already asking the center to step it up and to open it up to others. Perhaps because of the concern that if the healthcare workers keep saying they don't want the vaccine, others may not also want to follow suit. Is that a genuine concern, Dr. Parekh, according to you? Because, many people may say, well, these guys know the best. They are the medical fraternity. And if they don't want it, why should we take it?
Oh, absolutely. I mean, that is a very legitimate concern. And how are we going to address this concern or redress the view that if medical personnel are not coming up in large numbers, and as you have pointed out, a small percentage of healthcare workers has come forward to take the vaccine. So, Tanvi, I believe there are three things we need to do, and all three will need to work in tandem. First and foremost is transparency. If medical health workers who acutely follow development, some of them on a daily basis like me, were to be fully aware of what was going on, they'd come forth readily. We saw that one vaccine was set forth and data on that has not been forthcoming. I don't have access to a lot of that data, and it is not published in a peer-reviewed journal. So there is some concern on those grounds that we don't know what's going on. Secondly, there is no choice of vaccine. You go to a center and you have to take the vaccine that is available at that center on that day at that hour. People prefer to choose a vaccine, especially healthcare workers. So the first issue, Tanvi, is transparency. Then there is another issue, and that is flexibility. The government needs to be absolutely flexible in its approach, needs to be able to take turns based on what's happening. Now, we can pat ourselves on the back saying we are the fastest. We can pat ourselves on the back and feel complacent. But what should be the frame of reference? The frame of reference first should be our own target. We have set a target of 30 crores by the 26th of June, 2021. 1 month has gone and we've barely reached a crore. So if in 1 month we've not been able to reach a crore, it's going to require a phenomenal amount of acceleration to go 30 times that much in the remaining few months. And the other point of reference has to be our need. Smaller countries have different needs from ours. Our needs are monumental, and therefore we have to move fast. So what is the solution? I see a two-pronged solution. One of it is, of course, transparency, to let people have the data that is coming out and the data on which certain decisions have been taken. But more important, to get the private sector involved. The private sector in our country takes care of 70% of the health needs. Only 30% of our population goes to public hospitals for its care. Now, in every phase, whether it's the development of the vaccine, whether it's the manufacture of the vaccine, or the distribution of the vaccine, there has been cooperation with the private and public sector. So why not do it in the administration? So the quicker it is opened up to private hospitals, to physicians' consulting rooms, to private practitioners, with, of course, mandating that due precautions are taken for allergies and anaphylactic reactions, the quicker this vaccination program is going to accelerate. Given the current way of doing it, one would have to do a lot more than hope and pray to hope that we meet this target by the 26th of June?
Yeah, in fact, I was just going to put some of those numbers out for our viewers as well to say that we vaccinated, say, a little under 1 crore, 87 lakh as the number stands today. 3 crore in the first one, 30 crore was the intention by June, and we were hoping by then it will be put out in the open market. 136 crore people in this country. Tuhin Sinha, then when do we speed it up? At this rate, even to do 30 crore is going to take very long.
Well, I would think we are pretty much on track to meet that target of 30 crore by June end. Now, teething problems were expected in the first month, as we saw, last year also at the time of the onset of the pandemic. But this time around, obviously, there were apprehensions in the minds of certain people insofar as the vaccine was concerned, number one, and number two, there were logistic issues. Now, again, if you look at certain states which I would say, invariably tend to be the usual suspects, they are lagging behind. But the more important concern over here is that merely the availability of vaccine should not make certain state governments lax when it comes to testing. So if you take the testing numbers of yesterday, while Uttar Pradesh had 1.2 lakh tests, which for a positivity rate of less than 0.8%, less than 100 cases or so, Maharashtra is still unable to ramp up the testing, which stands at around 40,000 for 4,000 positive cases, wherein the positivity rate is a good 10%. So I think this is where, to be honest, with a population of 135 crore, it is impossible to think that the entire population would be vaccinated, in a span of few months. But yes, from July onwards, once Novavax and once Sputnik V hopefully are out in the market and the private sector gets involved, I'm sure, the numbers would ramp up. But in the meantime, it is equally important to keep the testing diligent, to keep the testing numbers high. This dual approach is what will help us effectively combat.
No, but why are we not doing it right away? We've now taken a month to understand the system, to fix the loopholes, to get everybody settled into the system. What is stopping us, Tuhin, from saying, okay, the next batch, which is those above the age of 50, should also be allowed? If there are vaccine doses and vials going waste at the vaccination centers these days, then why are we not using it for people who actually want to get vaccinated?
So that's happening in a matter of a couple of weeks, so hopefully from first week of March. That's what the health minister has clearly mentioned. And like I said, I mean, our scalability is not an issue. If you look at, and I just gave you the example when the pandemic had set in, we had all sorts of concerns. But today, the turnaround time is one of the best in the world. So I think by mid-March, you will see an exponential increase, because when the Prime Minister mentioned this target, when the Health Minister mentioned this target by June end, it was a very clearly thought of target and a reasonable target. Because like I said, from July, when I see at least 2 new vaccines entering the market, any which way the entire strategy is going to change, and probably there is going to be a surfeit of vaccines. But right now, I think we are pretty much on course to meet the target of 30 crore by June end. And the initial glitches were expected. I think they could have been better. Like I said, I mean, state governments are responsible in many cases. But you will see a vast improvement from March first week.
Okay, so let's pick up this point and take it to our other panelists as well. Dr. Chauhan, would you want to come in on this? Yeah.
I would like to get realistic here. To me, India, education and health runs in the state level also, and states have very key role to play. But we are talking about nation, the whole country. So if some places there are some glitches, I think we should focus on those glitches. Let's take a call 1 month from now on this channel itself. So we will count our apples as it happens. Personally, I think it will be scaled up. It should be scaled up. Can we scale it up to the level? And then if you bring narratives of Novavax is coming, Johnson coming, you tend to indicate that maybe there's shortage of vaccine right now. On one side, we say there's no shortage of vaccine. We need people to show up. And I just now heard, which is absolutely true, the government has already announced that after first week of March, they'll opening up to 50 or 40, whatever, will take planning. So your people have to register, you have to work them. So I think in that sense, we are on track. we are, and why you have raised this question, we have been slow, and everybody has said pretty much the same thing. Initially, there were problems of whether the vaccines are safe, whether there will be adverse effect, or do we have the data. I think now, today, one can say there are 5 or 6 vaccines all over the world. All of them are safe. Their efficacy might differ from 5% to 10%. So I think that fear has gone out of people, or should have gone by people's mind. If there is a large population is reluctant to take these vaccines, if they are available, if they are safe, if they are protective, if they are a good thing to have, I think we should focus. Social scientists have to join in. I think we have to beat this drum on your channel, every channel. The vaccines, it's a social responsibility of all of us to make sure. As I said, this is a comfortable time. We have the transmission rates are not very high. Tomorrow, you don't know what is going to happen. That should be drilled into all of us, that we are still amidst of a pandemic. It hasn't gone anywhere. It can come back anytime. And I think this is the message audience should get repeatedly again and again, as it gets from the government, from people like us when we write, get vaccinated. And that's not the entire solution. If everybody gets vaccinated, doesn't mean pandemic will disappear. But it will be a major thing that we would have done to stop the pandemic. It doesn't ensure 100% because many questions. I think we are short of time. Whether
Yes.
the mutants will be protected or not, whether those who with the immunity wane away after 5 months or 6 months. I think we can have another discussion at the time. And these questions are being answered as the whole world is being vaccinated. Currently, the time is hammer this, we all need to get vaccinated. And there should be no hesitancy. There would be some residual hesitancy. Let it be that. I think we should all move on. Bulk, large number of us should just go and tell everywhere, tell our neighbors that in our house, vaccine is one of the most important way in which we'll get rid of this pandemic.
So here is, one of our viewers who's commented saying, why is vaccine rollout still restricted to government agencies? If we are willing to pay as citizens of this country, if we're willing to pay, that option should be available. Availability doesn't seem to be an issue, Dr. Shashank Joshi, obviously, because, we're not only exporting it as grants to some of the nations who may need it, we're also selling it for commercial purposes.
Absolutely. So the need of the hour is actually decentralization. And I think it is important to involve the private sector in a very mindful and a careful way. And I think that is the only way decentralizing and involving the private sector will hasten and meet the targets. Maybe we will meet the target a month earlier. But I think it is important that just like the testing, the government, central government needs to decentralize the vaccination process once the process is system is in place, and involve the private sector with all the checks and balances and diligence in place, just like they did for testing. And then that's the only way we can ramp it up quicker and faster and involve people who are vulnerable faster and quicker before another surge hits us again, which in some parts heterogeneously is hitting us after some governmental elections, like in Maharashtra, we had this Gram Panchayat elections. In Kerala, we had these local self-government elections. So obviously a mini surge was seen. But I think it's important that we involve, have transparency, and I think decentralize it to some extent. I think everything is sitting in Delhi and every small bit is moving from there. And that's a little cumbersome currently, and that is slowing down the process. It's important for them now to ensure that compliant places which vaccinate appropriately, they should fast track it now.
Oh, absolutely. In fact, I want to take this point further as well. But before I do that, let's also bring in some of our viewers, since we've opened up the phone lines and we must hear what citizens also have to say. Kamakshi is on the phone line calling us from Secunderabad. Good evening. Go ahead, please.
I am a 78-year-old woman and I'm very keen to take. I do not have pre-market conditions. However, I'm drawing a complete blank. When I called up Apollo Hospital, I called up the Municipal Corporation. I'm member of several senior citizen associations, and there I made the inquiry, and we are getting no information as to when the registration will start or when we would get the injections or the vaccination. That is my big question.
Yes, well, we ask the government this question almost every day, and our reporters are very, very persistent in, trying to figure out if there is a development. And I can tell you, the most recent conversation, which was yesterday and today as well, the government has said that they are on track with the original plan, that by March, somewhere in March, is when they will take it to the next phase, which is people above the age of 50. And those with comorbidities. They haven't yet finalized the list and the order of priority for comorbidities. So that process is actually still going on as we speak. That's not been finalized, which is why no announcement has been made. Tuhin, like Tuhin was also mentioning, in the next couple of weeks, we are hoping that that announcement is made and then this process starts. So only in March, hopefully, in the next 4 weeks, maybe sooner, Kamakshi, you will have answers to these questions. Thank you for calling, though. Let me also ask Dr. Parekh to you this question. Are there any pitfalls when we open it up to the private sector and bring them in? Should there be a section for a section of people? Should the control just be left with the government to say, well, as far as the poor and the vulnerable maybe are concerned, we keep the control, we carry on with our drive, but for the others who can afford it, let the sector take it forward?
Oh, absolutely. I mean, I'd be astonished if there are no pitfalls in changing policy. But if I may, and at the risk of sounding somewhat condescending, and I apologize for that, let's just do some primary school math together, Tanvi. We are looking at 30 crore vaccinations in 5 months. In the first month, we've barely done 1 crore, which means we are going to need an 800% escalation in vaccination on the next 4 months to be able to reach our target. I do not see that happening unless we open up to the private sector and unless we make it available more easily. Second, currently there is a surplus, mind you, of supply over demand. Some vaccines are going to expire unused by the end of March, or at least that's what the companies claim. And so it's imperative that these vaccines be used up quickly. And so while opening up in March to the next group is one thing, opening up as quickly as possible to the private sector, having vaccinations given very quickly is even far more urgent. Let us look at Israel. Israel was doing a good job with its vaccination, and the second wave that came in overwhelmed the vaccination to the point that it had to be arrested for a while so that they could deal with the second wave itself. And you alluded to that in the beginning. I remember the first few minutes you said that there may be a second wave, and before that comes, we need to do that. We need to do that because if the second wave comes in, just as we are dealing with the after effects of the first, that becomes an overwhelming problem. So we need to open up. But, as the lady who talked to us just now illustrated to us, we need transparency. If somebody picks up a phone, calls a hospital, or if you ask the government, there should be a clear answer. I mean, we are on track. That might sound reassuring, but I think that needs to be illustrated. So we are on track. Okay, we wanted to do 30 crores. In 5 months, we've done 1 crore. Why is that on track? Did we have a plan to do another 4 crores in the second month? Second, whoever picks up the phone should be told that, yes, it's likely to go to private hospitals because people are not all going to be able to call one phone line across the country. They will call their hospitals, they will call their doctors. Now, if people like us who have been monitoring this pandemic, mind you, for over a year, I was amongst the first people in the world to, in fact, we wrote the first book in the world on the pandemic. About 40 predictions that we made in January have unfortunately turned out to be true. So even some of us who are monitoring this in the scientific literature and elsewhere are not aware of what's going on. So I think the quicker we are transparent and answers are given immediately, if we can turn around a test result in 24 hours, surely we can turn around an answer in less time than that.
Yes, to Insana, would you want to respond to that? The need for more transparency, whether it's our viewers who are calling in saying we don't even have the information yet?
Well, number one, I would think the involvement of the private sector is inevitable. And, let me also, my personal assumption is that the availability of vaccine in the free market would also be a reality, though maybe, that would be later in the year. But yes, at this point of time, the initial glitches are mainly on account of laying or designing the contours of what is truly an unprecedented exercise. And that is precisely what is taking its time, because once the private sector also gets involved, the exponential rise in numbers will lead to certain pitfalls which have to be taken care of and addressed right at the start. But you might just see the private sector getting involved as early as March end or April. That's my sense of the situation. So while these concerns are valid, they need not sound alarmist. And I would reiterate that the numbers are pretty much. I mean, the target is pretty much there, because we have seen in the last 1 year the potential of our health sector to exponentially scale up and to ramp up depending upon the need.
Yes, but by April, yes, but that sounds 2 months away, and we're using 2 precious months when we are actually exporting our vaccines to Dominican Republic, to Barbados, to not just countries in our neighborhood, and it isn't just about government vaccine diplomacy anymore to win. The companies are also getting into commercial arrangements, but we're not giving it to people in our own country who are willing to pay.
No, I think that's a very generalized statement. If you look at state-wise breakup of the cases at this point of time, the 18 of the states, the COVID has virtually been redundant at this point of time. It's merely 3 states which are contributing to nearly 78% of the cases. So for now, our strategy, rest assured, and trust me, should be that while the vaccine is there, the testing should not show any increase. The states which are showing laxity in terms of testing, and that is where Maharashtra has always been number one. I think this dual approach needs to be there for some time, and probably for the next 6 months, because given the size of the population, it would be unrealistic, no matter how much you ramp up the vaccination drive, it would be unrealistic to assume that only vaccination would be the answer. This dual approach of diligent enhanced testing has to coexist with the vaccination drive for at least the next 6 months.
I completely agree with you, and if there is a concern that Kerala or Maharashtra weren't doing enough RT-PCR tests and had just resorted to rapid test, and that was the problem, all right. But let's not forget that we can't overly depend on the numbers itself. We've now got instances at a large scale from Bihar and its neighboring state where the testing numbers can't even be trusted. So if we say that, we can just go on with our testing policy and keep asking people to wear masks and vaccination can happen in its own sweet time, then we're just putting more lives at risk. I want to play out a couple of answers that we got from the government today, because we've been vehemently after this issue and we asked them every day, and today in the news conference as well, Mr. Bhushan responded to this aspect of vaccination, the speed, and if they see a scope for improvement. Let's play out that bite and we'll come back to our panelists.
That in the first 1 month in this country, we have vaccinated 60% of all healthcare workers, both in the public and the private field. पिछले सप्ताह की तरह चिंता का विषय केवल 2 राज्य हैं, क्योंकि वहाँ 61,550 एक्टिव केसेस केरला में हैं और 37,383 एक्टिव केसेस महाराष्ट्र में. So there is a scope for improvement that we accept, but the bigger picture should not be lost sight of, which is that in the first 1 month in this country, we have vaccinated 60% of all healthcare workers. There are some states, particularly 11 states and UTs, where less than 50% of the healthcare workers have been given their first dose.
There are some states which are doing well, others are not. Mr. Bhushan at one point also says that yes, there is always scope for more improvement. Dr. Shashank Joshi, reporters can file more than 1 story a week, maybe 1 every day. Similarly, in the vaccination process, you can step it up. But what would one expect from the government as a clear plan right now? And what does that entail? More vaccination centers or simply opening it up to the next group? Or do we just put it in the open market, more campaigns? How does one go about it from here?
No, I think we have to respectfully ramp up number of vaccination centers in an exponential way. We will have to involve the private sector. I'm not so sure whether they should be out in the shops for people to buy. I think the government needs to still have its control, but through a private sector as well. I don't think we should mix up the disease with the vaccination drive. These are 2 independent things. We have today only taken a meeting of the Chief Minister took a meeting to ramp up Maharashtra's spiking numbers in some geographies in a heterogenic way, which we are seeing that. And just because Kerala and Maharashtra is having a challenge, that doesn't mean the rest of the country should not have. We all wish and pray it doesn't have any problem, but it could be an early signal for others not to be complacent. Number one, masking will stay throughout 2021, whether you vaccinate or not vaccinate. That's the first message, and COVID-appropriate behavior cannot go. So let's not be living in any fool's paradise there. Number two, vaccination, earlier the better, and better involvement in private sector is better. Some degree of decentralization and some degree of transparency is mandatory. We have currently only 2 vaccines, one with data, which is also limited for India, one with data, which is in public domain partly. Both probably are safe and actually may have some advantages because they are made in India, but we need to have more vaccinations in order. And if we have excess vaccine supplies, we can definitely fast track involving a vibrant private sector which caters to a large health of our population. It doesn't hurt at all, because the earlier we'll vaccinate, the better will be the sting of the disease taken away. Remember, vaccination also will not prevent infection, but it will make it asymptomatic, and we'll have no fatality or less fatality and no severe disease. So that's really the challenge. So actually, overall, the public-private participation must be at its peak. There is no room for politics, but science must prevail. And I think we need to do it in a calibrated way.
Oh, yes, absolutely. In fact, let me quickly go across to another viewer who's on the phone line. Asha, calling us from Mumbai. Good evening.
Hi, Tanvi. If you look at Economic Times today, South Africa has returned 1 million COVID vaccines to the Serum Institute. Now, the efficacy of those vaccines was only 22%, while they had 90% efficacy in another area. Now, I want to raise 2-3 points. I work in hospitals. I'm a designer of hospitals. First of all, I had suggested to Cipla that they start the nasal vaccine, because it is very easy to make, because you're using nebulizers for all those that are on above the age of 50, 60. I myself am on blood thinner. I have a heart problem. I'm 78, but this is not the way to treat us. Second, please, I agree with Dr. Joshi, decentralize. I don't need a government official telling me how many people have been vaccinated. He does not tell me how many people have reactions to those vaccinations. So in the month of March, we are going to get nasal vaccines. Please get those back. Third, in the urban areas, you have doctors who can look after their patients. But in the rural areas, you are not getting any feedback of what is happening. It is just animals being vaccinated for rabies. We are looking just like that. Even when you're taking tests, you're pushing into the nasal and the gullet. It is so terrible to watch. You have to improve all these things. I suggest that you get every hospital to take over vaccination, every doctor who has people under 100 people to take charge. Swine flu was given to me by a ENT specialist.
Yes.
You're destroying vaccines. You are only putting us on trial. Please do something, Tanvi.
Oh, absolutely. Thank you so much for calling, Asha. And I do take your points that, as our other experts have said, it is time to perhaps bring in the private sector as well. Now, you want to keep your checks and balances and ensure that there is some kind of control in the system. All right. But right now, there is a growing sense that we are moving way too quickly. And the government, and the lead has to come from the central government. The states will have a big role to play, but the decision has to be taken by the central government. And if you agree and admit that there is scope for improvement, then let's go forward. I don't understand why the government isn't telling us, why are we already not opening up to the next set of people to above the age of 50? Your setup is done, you're expanding your centers, the staff is present, the doses are present. What is the delay? The plan should have been ready by now in terms of comorbidities and the order of priority. Very quickly, one of our viewers who called up and said, why don't we have Pfizer or Moderna vaccine yet? Well, actually, they haven't applied properly to our authorities yet. One of them did, and then they said, oh, we're not ready to make the presentation, and then they did. So there is a bit of a, slow response from the company side. Also, the government believes that we don't really have too much of the infrastructure to have these vaccines in terms of transport and storage. So maybe when it's opened in the and put out in the open market, these vaccines will also be in. There are two others that the government is very closely tracking: Sputnik and the Zydus Cadila vaccine. Hopefully these two will also be in the next couple of months. But it doesn't matter if you have 4 vaccines but not reaching to the people. If people are willing, and so many of our viewers today have tweeted to us and called us to say, we are willing, we want to know when and how. But the government needs to make that move now. Thank you so much for joining us on this conversation.